What causes type 2 diabetes? This is the most important question to ask because once you understand what causes it, you can try to reverse it. A lot of people will say, we don't know, but we know exactly what causes it. And I'll get to it coming right up. What causes type 2 diabetes? It's often considered a disease of insulin resistance. Insulin is a hormone that allows glucose to go from the blood into the cell. And when it doesn't work, it's called insulin resistance. So the glucose stays outside the cell and can't get inside. So why can't it get inside the cell? Insulin is present, the insulin receptor is present, but for some reason they're not working. And if you're to ask doctors, even specialists, to say what causes insulin resistance, they'll say something like, well, obesity. But how does obesity, that is increased fat mass, cause the blood glucose to go up? It doesn't seem to be very obvious how those two things are related. And that's where most specialists will say, well, we don't really know despite 50 years of research into the most important health problem of our time. Because type 2 diabetes and the associated metabolic syndrome, which is also known as insulin resistance, underlie the two biggest health problems that kill Americans, that is heart disease and cancer. So what causes insulin resistance? This is often conflated also with hyperinsulinemia, that is too much insulin. And we know that as you go from normal lean person to obesity to prediabetes to diabetes, that insulin levels progressively go higher and higher. You can see from this article from 1992, which is many, many years ago, that insulin tends to go up much higher even as the blood glucose stays relatively normal until you get to frank diabetes, where the insulin levels fall, although they're still much higher than normal, and because they're falling, the blood glucose tends to rise. So the too much insulin is often considered a problem that is caused by the insulin resistance. But what causes the insulin resistance in the first place? Well, that's what they don't have the answer to, and that's what we're here to discuss. When we talk about insulin and glucose, there's this lock and key paradigm. That is, insulin acts like a key that goes into a lock. So the blood glucose is outside in the blood, and it wants to get inside the cell like the liver cell. And insulin is like a key that opens up a gate on the cell, opens up the gate, the glucose is able to go inside. Insulin resistance is considered a problem that something is blocking, like a piece of gum that's in the gate. So the lock might be fine, the key may be fine, but there's a piece of gum that's sticking in there. But what is this gum that is gumming up the system? Well, that's where nobody has a good answer. And then that's what leads to the compensatory high insulin levels, and that's how we understand insulin resistance today. This is also called the internal starvation hypothesis or underfill, because the glucose outside the cell is very plentiful, but inside the cell is very low. And this internal starvation is seen in type 1 diabetes, where people don't have the insulin, which is the key. So therefore, the gates stay closed, the glucose cannot go inside, and people simply get increasingly thin and increasingly emaciated until they die because they can't use the glucose that's outside. So while there's an abundance outside, there's none inside. So this internal starvation certainly applies in type 1 diabetes, this internal starvation, but in type 2 diabetes, people generally have abdominal obesity and a lot of excess fat in the liver, fatty liver. That doesn't look like internal starvation to me. So when we think about insulin resistance, there are several possibilities. There is this underfill hypothesis or internal starvation where something is gumming up that lock. But there's a second hypothesis that is equally applicable here, which is the overflow paradigm. Let's suppose, for example, that there is too much glucose over a long period of time, which then goes into the cell under the open gate, which is opened by insulin, and therefore the cell is now full already. So even though there's lots of glucose outside the cell in the blood, it can't go in because the cell is full. Just like if you have a bar and it's Super Bowl Sunday, the door is wide open, but inside it's already packed. So you simply cannot go in. So this is the overflow hypothesis. So the problem here is that there's been too much glucose, which has caused too much insulin, which has caused the insulin resistance. So the primary problem is that there was too much insulin, or hyperinsulinemia, that caused the insulin resistance. And the solution here would not be to give more insulin, but to give less insulin or lower it. It's just like, for example, if you were to have a suitcase. If once you put the first few shirts into the suitcase, it goes in fine. But as it gets full, it's increasingly difficult to put clothes into the suitcase. There's nothing wrong with the clothes. There's nothing wrong with the suitcase. It's just overfilled. Or if you think about it from a subway standpoint, imagine that the cell is like this train and the passengers are the glucose. The insulin opens the door and the glucose goes into the train. Well, if you have a lot of glucose on the a lot of passengers on the platform that can't get into the train, there's two possible problems. One is that the doors didn't open, but the other problem could be that the doors are open, but the inside is full. And this is an overflow hypothesis. So let's think about what is more likely here. In the underfill hypothesis, you have this internal starvation. That is, some mysterious, villainous substance is gumming up the lock and key, which is causing insulin resistance, which is causing the hyperinsulinemia. And this mysterious villain has gone and eluded scientists of the entire world for 50 plus years, despite the fact that it's causing a worldwide epidemic. Think about the consequences of this hypothesis and what it would predict. It would predict that you shouldn't have fatty liver because, of course, the glucose cannot get into the liver. People should be very skinny, and if you lose weight, it shouldn't make any difference because there is internal starvation. But all of these are not what we see in type 2 diabetes. On the other hand, think about the overflow paradigm of insulin resistance. That is, the primary problem is that there is some dietary change. People are eating more carbohydrates, they're eating more frequently, and they're eating too much glucose over a long period of time, which has stimulated a lot of insulin. That is, it's allowing all this glucose to fill up the cell until it's completely jam-packed and full. Once it's packed, you can't push any more in. And that's what gives you the insulin resistance. And this overflow paradigm is going to predict several things. It's going to predict that you will have a big fatty liver, and will predict that if you reverse it, if you lose the weight, that everything gets better. Because when you're losing the weight, you're burning off the excess glucose, you're lowering the insulin, and therefore you are going to get rid of that situation by emptying out the cell of that glucose, which now gets rid of the insulin resistance. And the key thing here is to understand that this is a reversible situation. So what causes type 2 diabetes is too much glucose, which caused too much insulin, which overflowed your cells, the glucose spilled out in the blood, and as soon as you could measure the blood glucose, that's how you decided to have type 2 diabetes. In other words, type 2 diabetes is a disease of too much insulin. Obesity, similarly, is a disease of too much insulin. And that's why those two diseases are intricately connected to one another. That's the way that they go in line with each other, because we see that once we changed the dietary guidelines in 1977, we told people, eat more carbohydrates, eat less fat. Well, eating all that glucose, eating all that insulin, stimulating all that insulin caused obesity because insulin tells the body to gain more fat. And 10 years after that, you got an epidemic of type 2 diabetes. They were caused by the same thing. Well, what are carbohydrates? Well, carbohydrates, which are called starches, are made of chemical compounds called amylose and amylopectin, which are chains of glucose. If you're eating more carbohydrates, you're eating more glucose. And therefore, you're shuttling more glucose into the cell. You're packing the body full of glucose. Not the fats and proteins that we used to eat more of, but glucose. If you're eating glucose, which is a type of sugar, your blood glucose is going to go up. That's why carbohydrate-containing foods all have a very high glycemic index. So really, it's not all that difficult. Because if you think about type 2 diabetes, what caused it? If you eat a lot of sugar, your body eventually fills up with sugar and then it spills out in the blood. When it spills out in the blood, you have type 2 diabetes. It's too much glucose, which is causing too much insulin. Well, if you have too much glucose and too much insulin, how to reverse it? Lower the insulin by lowering the glucose. Low carbohydrate diets are very effective. Intermittent fasting is very effective. And now there's also drugs that help reverse some of the complications, such as Ozempic, the GLP-1 agonist, as well as the SGLT2 drugs that help you pee out some of the glucose. Once you understand that the problem that caused the type 2 diabetes was too much glucose causing too much insulin, well, the solution is simple. Stop eating so much glucose, which is a low carbohydrate diet. And this is not some fad diet. If you look at the Nutrition Therapy for Adults, which is from the American Diabetes Association, published in 2020, they state plain out that reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia. That is, it is the single best diet for diabetics. That's what the evidence says, and that's what the expert consensus is. You need to eat less carbohydrates because carbohydrates are the macronutrient that raises your blood glucose the most. And if you look at the real world experience, this is a general practice service from Dr. Unwin, who put all his patients with type 2 diabetes on a low carbohydrate diet, followed them for up to 8 years, and had an insane remission rate of type 2 diabetes of close to 50%. And for pre-diabetes, a 93% remission rate just by following a low carbohydrate diet. The second thing that can help, intermittent fasting. I wrote about it in 2015, 2016, when we published about the therapeutic use of fasting for people with type 2 diabetes, and it was able to show that people could come off of their insulin. This article, it showed how people were able to lose weight as well as reverse their type 2 diabetes just by intermittent fasting. And now the studies are everywhere. Randomized control trial here in 2022 showing almost a 50% remission rate once again by using intermittent fasting. Another randomized control trial here called the InterFast-2 showed 8 people with remission in type 2 diabetes versus 0 with the control. So intermittent fasting, very highly effective as well. You look at the number of people who reduced their insulin by more than 10%, 75% of those who did intermittent fasting. And it's not so hard to understand. If you don't eat, your body is going to burn off some of the glucose. And the problem is that your body had too much glucose to begin with. There are other ways to do it, including medications such as the GLP-1 agonists and SGLT2s, things like Ozempic. They will reduce how much you eat, which lowers your insulin. The SGLT2s make you pee out some of the glucose. So those are pharmacologic ways to do the same thing that the diets can do. But the whole point is that type 2 diabetes, once you understand what causes it, you can reverse it. And this is going to pay huge health dividends because it's going to reduce your rate of heart disease, it's going to reduce your rate of cancer, as well as all kinds of other diseases. Thanks for watching. I hope you learned something.